Welcome to Preparing for Your Shift Working with Persons with Dementia, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. This is the third and final Behavioral Interventions module. In this module, we will explore strategies for preparing yourself to work with people with dementia. We will also review a case study that will allow you to practice what you have learned in this series. This is the third and final Behavioral Interventions module. The information contained in this module is relevant for nursing assistants who are on the front lines providing care for patients, for anyone providing care to an older adult in any caregiving capacity, and even for those not in a caregiving capacity who are looking for ways to improve their knowledge and understanding. The purpose of this series is to provide basic education about dementia and suggested interventions for dealing with people with behavioral expressions. It is not necessary to complete the entire series in one sitting. You can leave and return to this course at any time. Here are the objectives for Module 3. 1. Learn tips for preparing yourself to work with people with dementia. 2. Learn strategies to introduce yourself. 3. Practice what you have learned through a case study example. Here is a summary of what you learned in Module 2. 1. Behavioral expressions are usually the result of an unmet need or want. 2. Behavioral expressions are not intentional. 3. There are many different types of behavioral expressions. 4. People with behavioral expressions deserve to be supported and treated with dignity. And 5. Acknowledge, affirm, redirect can be a useful intervention when dealing with behavioral expressions. How to prepare your mindset for working with people with dementia can and will impact how your shift goes. Here are some tips for preparing yourself for the day. First, take a deep breath before your shift. Don't set yourself up with negative thoughts. Remember, your clients have dementia which may interfere with their activities of daily living. Think about the people you'll be working with. Think about how you will bring care and caring into this day. When working with someone with behavioral expressions, keep in mind that these expressions are often an expression of a person's unmet need or want. Examples of an unmet need might be hunger, thirst, pain, constipation, or fear. Remember, these are just examples of some unmet needs. It's not an all-inclusive list. It is often helpful to introduce yourself with every encounter. It may help the person to recall who you are. Even if they can't recall, it shows respect. Here are some tips for introducing yourself. Look the person in the eyes when they speak to you, and speak to them. Include the person in conversations, even if they're not participating. Don't talk about the person as if they are not present. It is important to establish a routine when working with someone with dementia. These tips might be helpful to have posted in the break room or work area so you remember what they are. Establish a daily routine. This could change from day to day or from person to person. Take your time. People can tell when you're rushed, and it generally makes them anxious. Prepare yourself in understanding that tasks in people with dementia may take longer than they used to. Allow time for breaks during tasks. Some tasks will require more energy from person to person. Involve the person in the cares. This shows respect and helps them to do the things that they can still be doing. Allow the person with dementia to do as much as possible. Provide choices. Don't make it complicated. For example, would you rather wear the blue shirt or the black shirt today? Provide simple instructions. It's important to acknowledge that staff consistency can impact how people act. As you've probably seen, staffing changes can produce behavioral problems. Staff who don't have experience working with people with dementia may not understand the disease process, and also may be uncomfortable because of that. For example, if the person asks you every 2 minutes if it's 12 o'clock, an experienced staff person would know to try to change the subject and change the focus. If it wasn't done, the person's behaviors could worsen. Even when you are working with someone who doesn't have experience with dementia, it may be helpful to offer some hints. Education about dementia is crucial. It's crucial for all staff and should be offered during orientation for new hires. Now we'll review a case study where you can test what you've learned in these modules. Mr. Taylor is a 75-year-old African American with a few other illnesses and gets around easily in his wheelchair. He was diagnosed with Alzheimer's disease 4 years ago and has lived with his daughter ever since. He has recently had problematic behaviors and can no longer be left at home. Here's some more background information. In the beginning, Mr. Taylor would miss words in the middle of a sentence, and gradually his condition worsened. When left at home alone, he turned on the stove to cook, left the food, and went for a walk. He got lost trying to find his way home. When his daughter came home to check on him, she smelled smoke and ran into the kitchen, where she saw her dad had been cooking something that was now burned. She quickly moved the pan to safety and called for her dad. Her father didn't answer, and she noticed the back door was opened. She ran outside to find her dad sitting on a bench in the park. When she tried to get him to come over to her, he became angry and combative. She called 911 and her dad was taken to the hospital, where he was diagnosed with Alzheimer's disease with behaviors. The social worker recommended placement in a nursing home with memory care. Here's what happened once he was admitted to the nursing home. After his daughter got him settled into the nursing home, she left for the night. Early the following day, Mr. Taylor's nursing assistant came to get him ready for the day. He did not want assistance. Instead, he demanded that the nursing assistant call his daughter immediately. He said his daughter was waiting for him to call. Unfortunately, this was just a shift change, and the nurses were reporting off. The assistant asked the nurse if someone could call Mr. Taylor's daughter. The nurse gave the aide the chart and told her to find his daughter's number and give it to him. The assistant found the number and gave it to him along with the phone. She then walked away to work with the other clients. Mr. Taylor had no idea what was handed to him. He proceeded to yell and became upset. The staff tried to calm him, and by asking what was wrong again, he said he needed to call his daughter because she was expecting him to call her. The nurse then explained to him that they were busy and they would try to assist him once they were done. Mr. Taylor became so angry that he started throwing things, swearing, and hitting anyone who came near him. The staff tried to calm him but could not. The nurse gave him a sedative to calm him down. Can you think of ways that this situation could have been handled differently? What would those ways be? If you are viewing this as a group, pause for a moment and talk amongst yourselves. Here are some alternative ways that the situation could have been handled that might have changed the outcome. The nurse aide could have talked to Mr. Taylor about his previous job or things that he and his daughter liked doing. She could also have given him a magazine or allowed him to participate in a group activity until the staff really was available to address his needs. Someone could have taken a few extra minutes and called his daughter for him, explained what was going on, and allowed him to speak to her. His daughter could have been encouraged to tell him to go with the staff and enjoy his day until she could visit. Here are some additional information about Alzheimer's. Currently, a cure for Alzheimer's does not exist. Some medications will help lessen the symptoms or stop further progress of Alzheimer's. There are both drug and non-drug approaches to addressing the behavioral and cognitive symptoms. Medications for cognitive and behavioral symptoms work best in the early to moderate stages of Alzheimer's. There are other treatments for behavioral and sleep changes as well. More information about this can be found at alz.org. Here is a summary of Module 3. Prepare yourself for the day. Set yourself up for the positive. Introduce yourself in a person-centered way. In general, it'll take longer to do activities of daily living in persons with dementia. All people with Alzheimer's disease with behaviors do not need medication to calm themselves down. All staff need to be aware that at times a simple conversation could change the outcome for a person. You, as a frontline worker who sees the client on a day-to-day basis, are the best person to find ways for calming people who have been diagnosed with Alzheimer's disease with behaviors. This slide references the document that we referenced when developing this module. Now, test your knowledge. It is now time to test your knowledge. Follow the link on the Frontline Forces webpage or in the YouTube description below to the Preparing for Your Shift for Working with Persons with Dementia quiz.